Hey guys, it's Louis here from ndxtesting.com, the channel where we give you medical care solutions and give you diagnostic information so you and your family can stay healthy, and also to help you to make good decisions when it comes to your health. Now in today's video, we're going to speak about what happens when you get into a car accident, and what happens when you need to find yourself an attorney after that accident, or perhaps maybe find a medical facility for treatment because maybe your neck hurts. Maybe after the accident, your neck hurts and your back hurts, and maybe you have some shoulder issues, maybe your elbow's compromised, maybe you broke your wrist or you fractured your wrist, your lower back, your hips, your knees, ankle. It could be a lot can happen after an accident. Maybe during that accident you were driving, or perhaps you were the passenger, or maybe you were crossing the street and you got hit by a car. I mean, it's happening so much now with people looking at their phones. Everyone's distracted. Or perhaps maybe you're riding your bike and you get hit by a car. Or maybe slip and fall in someone's business or personal property. Maybe you were working and you got hurt at work. If that happens, then obviously you have a workman's comp case. If you're driving your car, there'll be a no-fault case. If you have no-fault insurance. If you're riding a bike and you get hit by a car in New York or any in the 5 boroughs, then you have also, your no-fault insurance covers you a percentage when you get hit by a car. And if you're riding a bike, and obviously whoever hits you, you can sue them if there's a case. So there's a lot of scenarios. We're not going to discuss all the scenarios when it comes to you, but we're going to give you just basic information as far as what to expect after you get into an accident. But we're going to focus on the medical facility that you're going to go to, because that's where it's important. Because there's a lot of personal injury facilities out there that don't really take care of their patients. So what happens after you get into an accident? Don't forget that it's very important that when you get into an accident, after that, if you can, obviously, if you're conscious, of course, you need to document things. You need to take pictures. So if you're riding a bike and you get hit by a car, well, take a picture of that bike. See your pictures. It can tell the attorney 1,000 words. Because if you're hurt and all of a sudden your bike is like all mangled, here, the attorney can make a case for you. But if you can't see the picture of that bike, then they could still make a case, but the picture of that bike will definitely help. Take pictures of your car. Take pictures of yourself. If you slip and fall in someone's business or personal property, take pictures. Take pictures of where you fell, if there's water. If you fell over a banana peel, take pictures of that and keep it. Take pictures of your shoes. Maybe your shoes, where you have slippery shoes. It's not your fault. I mean, there's not supposed to be water there. But you need to have documentation. And obviously, you need to have a police report. Okay, and you need to contact your insurance company, no matter what. But you find yourself an attorney. It's a lot of personal injury attorneys in New York. You got to find yourself a good one, and you got to find yourself a good medical facility. Fortunately for myself, I'm a technologist and I work in the best personal injury facility, I think. And I've been to quite a few. Sometimes when I was a lot younger, I would go to interviews and to these places. I'll go right in and come back out. I was kind of picky of where I had to work. And sometimes you could. If you're good at what you do, then you can just choose where you want to work. And I've worked in nice places. And I work with good doctors. The doctor that I work right now, she's the best at what she does because she cares for her patients. We care for patients. But anyway, so when you go into the medical facility, right, what can you expect? What can you expect to happen? What kind of tests are you going to have? Well, obviously, when you seek treatment, you're going to have a physical therapist. The physical therapist is going to treat you. Okay, but before that, you see the doctors. Okay, the doctors that concentrate on personal injury, Two main ones, either a physiatrist. I work with a physiatrist, and you have a neurologist, and you have maybe pain management specialist, but physiatrist is the way to go. And that physiatrist can send you, if you need other doctors, they can send you to a neurologist, they can send you to a pain management specialist, they can send you to an orthopedic. They kind of manage your health when you come into the practice. They do a careful examination as far as your symptoms. They establish a clinical diagnosis when it comes to your symptoms. And obviously, your clinical diagnosis has to match your complaints. Example, if you have neck pain, let's just say some shoulder pain after the accident, maybe it's radiating into the arm. Well, they examine you. They examine your range of motion. They can establish a clinical diagnosis when it comes to your neck, when it comes to your shoulder, when it comes to your fingers. They go over your medical history. And if it's the lower back, hips, they check everything. Because there has to be a strong clinical indication that something's wrong with you so they can treat you. Because if nothing's wrong with you, then there's nothing they can do. So after you get examined, there's two main tests that you need. And that's the MRI and EMG, which we're going to discuss in a few. Okay. But also, so after that, then you're probably going to need treatment. What kind of treatments can you have? Well, you have a physical therapist. A physical therapist, they treat you in the practice. They use electrical stimulation to kind of stimulate your muscles. They kind of use a little bit of ultrasound to apply where it's painful, where it hurts, to kind of make this pain subside. They do stretching exercises. Some do massage therapy. They do acupuncture. So when you do acupuncture and when you do physical therapy correctly, those two treatments combined can definitely help you in your rehabilitation of your body. And also, you get in our medical facility, you get medical supply. Let's just say your neck, then you could get a neck brace, or maybe the shoulder, or maybe stuff for your elbow, okay, a wrist brace, whatever. You get some supplies to be able to help you, so you can take home. Maybe a back brace, a brace for the knee, for the ankle. And in a lot of different medical facilities, they do that. So when it comes to treatment, they pretty much take care of you. You got the main doctors and you got the PAs. You got the acupuncturists, licensed medical physical therapists. And you have technologists like myself that do tests. Now, the chief test that you do in order to be able to prove something's wrong with you, because the way it works is this. You have your symptoms, okay? You have your complaints. Then you have a clinical diagnosis that matches your complaints. And then you need two exams that have to kind of work with each other, correlate with each other. And those are MRIs and EMGs. Now, the EMGs is what we do. So what is an EMG? Well, the EMGs are nerve and muscle examination. The nerve examination is done in the extremities, meaning arms and legs. So if you have, let's just say, neck pain, lower back pain, shoulder pain, hip pain, knee pain. The nerve examination, what we do, we use electrical impulses and we study nerves that originate from the neck. So all the nerves you have from your shoulders to your fingertips originates from the neck. So when we study these nerve potentials, we kind of take pictures of them and we'll be able to see there's something going on that's coming from the neck, depending on the location. See, if you have neck pain, it could definitely affect your shoulder. It can radiate into the shoulder. It can radiate into the arm and to the wrist, depending on the location where you have the neck pain. So the EMG gives us a lot of information. Like I said, an EMG is a nerve and muscle study. So once a nerve examination is completed by a person like myself, my specialty is in electrodiagnostic medicine, the peripheral nervous system, which is nerves and muscles. So I check you out completely. So we complete electrodiagnostic study when it comes to your nerves. And then after that, then the doctor comes in, the physiatrist comes in, the doctor of physical medicine specializing in EMG. So she doesn't use electrical impulses to study your nerves. She uses an electrode to pinch the muscles in the neck. So if you have some neck pain, so she'll pinch that muscle in the neck and study the electrical activity of that muscle. She'll do the same thing on the shoulder, some of the extremities. If you have lower back pain, she'll do that in the lower back. We get a complete diagnostic view when it comes to your body, when it comes to your nerves and muscles. Then you also have the MRI. Depending on your clinical indications, depending on your complaints, you might need, let's just say, an MRI of the neck, one of the lower back, and maybe one of the shoulder. Now, when you take an MRI, it's going to give you information about your bone structure of the neck and your disc. And your spine, so you know, it's divided into 3 different levels. You got the neck, which is the cervical spine, the thoracic spine, which is the mid-back, and then you have the lower back, which is the lumbar spine. So if you have a cervical MRI, they're going to give us information about what's going on with your spine. Not too much. We're not going to go too much into that. If you want to see a little bit more information about the MRIs and the EMG, I have a video. I'll post it in the link, or you can go into my channel. Okay, the video reads cervical radiculopathy, which is a condition of the neck when you get hurt, for the EMG, and it herniated disc and neck pain. You can watch that video and you can see a lot of what I'm speaking about, because then we're going to prolong this video too much. This video is just to kind of give you an overview, basic understanding of what's going to happen when you go into the right place, when you go into a good place. The MRI would definitely give us a lot of information. So with the MRIs and EMGs, we need 2 exams to kind of correlate, kind of support each other. And then obviously, if you need one of the lower back, then it gives us information about your lower back, your knee. So your case or your conditions get supervised. Let's just say you need an orthopedic specialist for your shoulder. Well, they'll send you to an orthopedic specialist. If you have some knee issues, then they'll send you to a knee specialist. And everything that you need for your complete rehabilitation. And then as far as your case, you have an attorney. The attorney will be provided all the information that he needs in order for him to make a plea for your case. As far as you have any questions regarding this video, you can post it in the comments below. And I was just wanted to keep this simple. This video was requested by one of our patients. And we're going to make a little bit more videos about this as far as what happens, what you should do, and more in detail as far as when you get into an accident. But if you go to the right place, it's going to be a good experience when you have the EMG study, which is a nerve and muscle study, when you have the MRIs, when you have your treatments. But going to the right medical facility, going to the right doctor after an accident is really, really important. And we see patients all the time, and my job is always to make them feel at ease and understand their complaints. I always try to do my best. And as far as the nerve examination that I perform, I also do follow-up studies as far as somatosensory studies. It kind of gives a little bit more information after you do that first EMG about the central nervous system and the peripheral nervous system. Anyway, guys, I hope you found this video helpful. If you like it, then refer it to your friends, family. And if you want to subscribe, please. We're going to take out a lot of different videos, a lot of different topics when it comes to medical care solutions, so you and your family could stay healthy. Turn on your notifications so that way when we take out our next video, then you'll be the first to know. If you have any questions, if you have any videos that you want to see in the near future, then this is a new channel. We do have time to kind of cater to these things. With that being said, I'll see you in the next video. Bye-bye.